Have you ever been breathless? So breathless that it was unpleasant. So breathless that you could not imagine anything but managing to breathe. Now imagine never being able to lose that feeling. Try walking up and down a flight of stairs breathing through a straw. Then you might have the slightest idea what it is like to live with chronic lung disease. People living with chronic lung disease feel breathless with the simplest of activities, from getting their mail from the mailbox to hanging out the washing. The difficulty people with chronic lung disease have with such activities can lead them to stop being active in their everyday lives and spiral into disability. Costs also spiral out of control. Respiratory disease cost the Australian healthcare system $4.59 billion, which was similar to the cost of cancer and more than nervous system disorders or diabetes. The Better Breathing Foundation has been established to change the lives of people with chronic lung disease. The Better Breathing Foundation is supporting high-quality research in kids' diseases, such as cystic fibrosis and asthma, as well as adult diseases such as chronic obstructive pulmonary disease or COPD and bronchiectasis. The Better Breathing Foundation is unique in providing scholarship funds to allied health researchers to conduct research on chronic lung disease. The foundation scholars will complete PhD studies at an Australian university. This initiative is particularly exciting as the research work will help find better ways to manage the debilitating effects of chronic lung diseases, and will also ensure that we are developing the skills of homegrown Australian researchers. Allied health researchers can include physiotherapists, speech therapists, dietitians, exercise and sports scientists, and occupational therapists. They all play a critical role in managing people with lung disease both within the acute healthcare system and in primary care. No other foundation in Australia has focused on supporting this group of health professionals in improving the way they manage chronic lung diseases. Allied health researchers completing PhD studies have had great success in changing clinical practice. They have led the way in developing evidence-based interventions to manage chronic lung disease. For example, interventions such as exercise training programs for people with COPD and CF, and medications like hypertonic saline for people with CF, and oxygen therapy for people with COPD.
My name is Sonia Chang, and I'm the inaugural Better Breathing Foundation Scholar. I'm currently undertaking my PhD studies at the University of Sydney, examining ways to reduce too much sitting in people with COPD. During the university years, we're taught about the importance of evidence-based practice and how to interpret and conduct research. But once we leave university, the opportunities to be part of research are limited, and this is partly due to a lack of available funding. The Better Breathing Foundation scholarship funding has given me that opportunity to pursue an academic career, to work with the leading clinicians in the field, and to help contribute to the body of knowledge of how we treat and improve the quality of life of people with chronic lung disease.
Sonia's scholarship was funded by 4 donors contributing $10,000 per year over a 4-year period. We have other applications from PhD students like Sonia that need funding. Please help us to help them.
All donations can be made to the Foundation through our website. Donations are fully tax deductible, with 100% of your funds directed to the research scholarships. Please consider donating today and improving the lives of people with chronic lung disease.